There were, however, a new high of 847 new cases of coronavirus COVID-19 reported yesterday. All cases were locally acquired. This brings us to some 7,611 active cases, and tragically one person has passed away, a man in his 80s from Hume. And we pass on our deepest condolences to that person's family and friends and community. 79% of yesterday's cases were aged 50 or under, and the proportion of cases over 50 as total number also starts to rise, but this is still largely a outbreak of people under 50, the young and the unvaccinated. There are 321 people currently in hospital with COVID-19, and 65 of those 321 are in intensive care and 45 are on a ventilator. 59,342 tests were processed yesterday, and 37,220 vaccines were administered in our state-run hubs. 77.1% of our 16 and over population has now received their first dose, and 46.9% have received a second dose. We are closely watching regional Victoria as the number of cases steadily but slowly rises. The Chief Health Officer will, within the next 24 hours, have more to say about restrictions in both Mitchell Shire and the Greater Geelong area, both of which are due for their current series of public health lockdown measures to be reviewed. However, the Chief Health Officer has advised that given the really good efforts that we've seen in Surf Coast, that they will definitely be coming out of lockdown as at 11:59 p.m. Tomorrow, Sunday the 26th. In regards to Greater Geelong, things are looking relatively positive. There are still a couple of investigations and data being run down with the local public health unit, but there are still some cases there. There were 3 new cases reported from today. 2 are known social contacts and 1 is being investigated. And as I say, Surf Coast, there was just the 1 case, a new case at a business identified through staff surveillance testing at that facility. There was also another new case in the Corangamite Shire. This was linked directly to the Ballarat case from yesterday and has seen a large number of exposure sites across southwestern Victoria. Some 33 have been uploaded onto the department's website yesterday. Whilst mostly Tier 2, nonetheless there are some Tier 1 sites, and I would encourage anyone who'd been to those sites to clearly get tested and follow the appropriate instructions as to how to get tested and isolate and deal with the issues. Additional testing has been set up in that southwestern part of Victoria through our friends at Barwon Health. And there were also 7 new cases in Mitchell Shire, continuing the larger number of cases in that regional shire, and given its immediate proximity to the northern suburbs of Melbourne and the number of incursions crossing that metro regional divide, the prospects of Mitchell Shire continue to grow in numbers is one that we need to forecast, because Mitchell Shire does reflect those patterns of how essential workers, particularly links to construction and other sectors, have seen a quite large number of cases proportionately to the rest of regional Victoria. that gives us an opportunity, obviously, to stress that that if you don't have to move across the regional boundaries, then you should not be. That is what is seeding infections into the regions, largely from Metro Melbourne. But of course, if you are, through a permitted reason or an essential worker, able to do so, you take your restrictions with you as you travel from the region, from the city into the regions. We continue to see, unfortunately, so many of the cases, both in metro and the regional settings, being areas of people, whether it's seeded from a workplace or a particular sector, into social settings. The majority of today's numbers, come from transmissions in homes and families, in social settings. People leaning into the prospect of, it doesn't apply to me, I've always looked after, for very good reasons, my family, I'm going to just have dinner with my family, my parents, my grandparents, I'm looking after my wider family's little kids, all the things that in normal times we take to be our total obligations as community members, but which in these times, with large numbers of social transmissions of COVID virus, spreads the virus. So please, the public health rules are there for the very good reason of seeking to minimise transmission, whilst we at the same time seek to maximise vaccination rates. So please, the rules of not visiting other people's homes in social settings are there to avoid precisely this. And in regards to vaccinations, we continue to see Victorians come forward in really strong numbers, not just at state clinics, but increasingly as a proportion overall of primary health and pharmacies, as their proportion starts to grow. As you'll recall, Victoria, as the state clinics, signed up originally to be about 25-26% of the vaccination program under the Commonwealth's rollout. We've been pushing that at around 50%. It's pleasing now to see primary care and pharmacies grow their contribution as their proportion of vaccines proportionally increases as we head into the back quarter of 2021. But what it also means is that we were pleased yesterday to receive confirmation from Lieutenant General Fruin and the COVID Shield plan that we now had confirmed Pfizer allocations for October. Whilst it wasn't at the higher levels that the Horizon document forecasted, and whilst it wasn't at the higher levels that we are confident that all parts of the Victorian distribution system for vaccines can get into the arms of Victorians, it nonetheless gives us more certainty and more predictability to continue our run to get as many vaccines into as many arms as possible. It means more bookings can be opened and we can make sure that we get those jabs in those arms to get us closer to those COVID normal outcomes and transitions from 70% and 80% double dose of 16 and over out the door as quickly as we possibly can. We're also very focused on bringing the vaccines to the areas that need them most, especially in the north, the west and the southeast of metropolitan Melbourne. And this allows us that equitable distribution of vaccines into the highest risk communities, and the relative certainty that the confirmation from Lieutenant General Fruin gave us allows us to continue to ramp up those targeted hubs and targeted measures of engaging with community to get the vaccines into the arms most at risk. And there are a number of those vax hubs in both the north and western suburbs and new community hubs, as we've outlined in recent times, continue now to be able to be rolled out in schools, in pop-ups, and further improving the vaccination opportunities in different communities.